feels like I'm a geriatric geriatrician, because I worked in geriatrics for quite a long time, and I met so many old people, and I knew what it was like to be old. And now that it's happening to me, it's very realistic. I feel we could have gone further, but for what we have achieved already, yes, I'm very happy about it. I think we could have reached more African countries. When we came, there was only 3 countries before us who had palliative care. Now there's 37. I had visited 34 countries. There's 54 countries in Africa, so there's a lot of work still to be done. I'm very proud of my team because they have been such a great support, and they learn very fast. I always say the African brains are better than the Mzungu brains. They do learn very fast, and they're very dedicated to the work that they're doing. I don't know whether I've got a best memory. I think it's all been wonderful to work in Uganda. It's been a privilege, actually, to work here. When we started, we put the model in Uganda, and it has worked. We started the Palliative Care Association. That covers the whole of the country, and they do a great job. We also helped start the African Palliative Care Association, and they are doing very well as well. More than 50% of our patients are below the poverty line, and many of them can't pay. So we're having to pay for them. We run out of money so quickly, like that. You can help me with that one, the people I'm talking to, because we do really need funds. There's Hospice Africa UK, which is the founding organisation. There's Hospice Africa Ireland, there's Hospice Africa USA, and there's Hospice Africa France. Hospice Africa France supports the Francophone countries. When I think of our vision, palliative care for all in need in Africa, all, not just Uganda. That's why we have international programs. I'd like to be remembered just as me, just as me, or the person that brought palliative care to Uganda, which allowed us to go to the other countries. So we've brought it now to so many countries, and every country I've been to, I just love going because they have different cultures, they have different beliefs, different finances, and yet everybody that we reach out there, they love Hospice Africa, and they're available for us to speak to at any time. The one that stands out most is a recent one. She had 2 children with her. One was about 15 and one was about 10, I think. And she said to me, "I'm a prostitute." I immediately thought of Jesus and the Good Samaritan, not the Good Samaritan, the Bad Samaritan, the Samaritan lady at the well. And she said, "And I have 2 children. And the eldest one, the 15-year-old, has Down syndrome, and the other one, the 10-year-old, is paraplegic. He can't use his legs at all." And she had nowhere to live. And she was going down the road asking people could they give them shelter for the night, and they might let them have a shed or something if they had a shed. And I thought, we are really needed here. You know, the needs in Africa are huge, and there is a problem in that people don't want to give money to Africa because they think it's very corrupt. The other problem is palliative care is the lowest priority in health, and when you're looking to a health organisation for funding, you're at the bottom. The team is my inspiration. The team here, they're working so hard, and they're always available. You know, now that I'm old and frail, there's always somebody to come to help me. But they also like that to all the patients. Pray for our work, that it will extend to all of Africa. Please donate if you can, because every patient deserves treatment, and the majority of us have not ever seen a medical worker in their lives because it costs so much to go to hospital.
If you were given one wish for your birthday, what would that be?
Every year, coming up now, we visit at least 3 more countries, and gradually get it that the 54 countries fulfills our vision of palliative care for all in need in Africa. Is it okay? Have you got it?
Yeah.